hello. You must be my 1 o'clock appointment? Perfect. Please have a seat right there. And I see you are here for your annual eye exam. Perfect. And you're a new patient. Wonderful. How did you find out about this practice? Okay, great. I always appreciate when our patients recommend their friends. So, very nice. And I have your basic info here, but I do have a few other questions. So, when was your last eye exam? Was it last year? Okay, so 2 years ago. Any reason you missed last year or just busy? Okay. Do you wear glasses or contacts? Okay. So you did have LASIK. And when was that? 5 years ago. And how has your vision been since then? So maybe a little blurry when you read. Okay. Yeah, that's normal. Even when you have a LASIK procedure done, there's a chance that with time you may need reading glasses, so we can take a look at that. Did you have any post-surgery issues? No? Okay. Well, I'll just take a look and make sure everything is still in place and healed properly. I know it's been 5 years, but it's always good to check. And let's see. Any eye issues recently? So, inflammation, soreness. I know you said a little bit of blurry vision, so I took note of that. Any other vision disruptions? What about any headaches? Okay, good. Wonderful. Well, I think we're ready to begin. So I'll be not only checking your vision, but also checking your eye health. All basic tests, so nothing you have to worry about. So let me just get my supplies together, and then we'll get started. So, first off, can you just look directly at me, please? Very good. And I'm just going to gently palpate your face, specifically around your eyes. Is that okay? Perfect. Just used hand sanitizer, so nice and clean. And so, doing this will just help me make sure there's no inflammation around your eyes and your temples. And I do see your under eyes are quite dark. Do you have trouble sleeping? You do. Okay. Okay, perfect. So the next thing I'm going to do is a field of vision test. So let me actually just clean this. I'm going to be placing this on your eye area. Okay. So I'm first going to cover your right eye. Okay. So just tell me when you see my fingers in your field of vision. You don't have to tell me how many, just when you see them. So you can simply say yes. Good. 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 And we're going to switch to your left eye. Same exact thing. Okay. Good. 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 Okay. So, I didn't notice anything, but did you have any difficulties with that test? No. Okay. So next is the basic vision test, which I'm sure you've done many times before. So can you cover your right eye for me? And I'm just going to hold this back here. Can you read this line for me? Good. This one? Good. That one? Good. That one? Good. Cover the other eye. Same thing. Can you read this line for me? Good. This one? Good. This one? Good. And that one. Very good. So I think you did fine, but did you feel like you struggled at all? Some more close up. Okay. Okay. Your vision is fine though for distance. So very good. Now I'm just going to place a few different lenses in front of your eyes. Just curious to see if you can see a little bit better with these light prescriptions. So, starting with your left eye, can you just tell me which looks clearer? One or two? Okay. Three or four? Okay. Your other eye, same thing. One or two? Okay. Three or do think reading glasses might help you. But we're just going to do a few more tests for your eye health. So now I'd like to take a look at your ocular nerve. So I just need you to pinch your nose and hold your breath. And when you do that, look directly at the wall behind me, okay? So on the count of 3, just do that for me. 1, 2, 3. Okay, very good. Perfect. Now this eye, same thing, count of 3. Pinch your nose and hold your breath. 1, 2, 3. Very good. Okay, perfect. Ocular nerve is looking fine. So next I'm going to check your sensation around your eyes. You may have had this test done if you ever had a cranial nerve exam. But if not, all I'll be doing is placing this in different spots around your eyes, on your eyelashes. It won't hurt. Your eyes will be closed. Every time you feel it, just say yes for me. So let's begin. Close your eyes for me. And I'm just going to start gently touching. Good. 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 And right on the top. Good. 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 Perfect. So have you ever had a colorblind test? No. I think you do not have any color blindness issues, but I just like to check to make sure. Especially since you haven't had an exam for a few years. And no issues with seeing colors. Okay. So I just need you to tell me what number you see. Can you see what number this is? Very good. It's a 5. The next one. Now, what about this one? Very good. It's a 7. Do one more. And what about this one? Perfect. It's an 8. Alright, so lastly, I'd like to dilate your eyes. It will take about 15 to 20 minutes to fully dilate them. Then I'm going to take a close look at your pupils. Have you had your eyes dilated before? Okay, so you know that when you leave, you might need sunglasses. It will be very, very bright outside. And when you return home, are you working on a computer? Okay, your vision will be a little bit off for a few hours, so you might have to just let your company know. Alright? So let me get the drops here. And I need you to just look up for me. So your left eye first. Two. Okay. And now your right eye. Yeah, you can blink. You're fine. And 1, 2. Okay. Just blink, blink, blink. And then I will be back in a few minutes to take a closer look at your eyes. Alright. So, blurry vision, I'm assuming? Yeah. Your eyes look dilated. So, we can finish this exam. Just a few more things. So, first, just look directly at me. And just seeing how your pupils react to the light. You can blink. Yeah, you can just blink as usual. Very good. Okay, very good. Now, can you just follow this light for me? Everywhere it goes. Yep, good job. Keep following. Okay. Perfect. Now I'm just going to look at each eye one at a time. So let's start with your right eye. So can you look to the left for me? Okay. Now look up. Okay. Look down. And look to the right. Okay. Good. Now your left eye. Can you look up for me? Okay. Look down. To the left. And to the right. So just follow it everywhere it goes. Okay. Very good. Okay. And look straight ahead again. Good. Good. Alright. Pupils look wonderful. The only thing I noticed is they are a bit dry. Do you suffer from dry eyes? Sometimes. Did it start happening after the LASIK? Yeah, that's so common. I'm assuming you already take drops, but I can give you some more if you'd like. Alright. So I did determine that you do need a light prescription for reading. Nothing to be fearful of. You can just grab a pair from a pharmacy, or I can even give you a pair here as well. So I suggest using them when you're reading or looking at anything up close. So here is your sample pair, and you can try them on. If they don't work, it's fine. It's just a free pair that we offer here. So there you go. And then I also have drops for you. So these ones I definitely recommend. And they are long-lasting hydration. And let's see, protection to the ocular surface cells that can become damaged due to dry eye. Very good to use following LASIK. And these drops are preservative free, so you can use them as much as you need to during the day. And they just come in these little vials. I find that even though they're single use, you can get away with using one vial about 2 or 3 times in a day. So just make sure they're in a clean area if you do choose to use them more than once. Now I'd like to see you again in 1 year, unless anything changes. Do you have any questions for me? Perfect. Well, I have all of the notes that I'll be putting in the computer for you. You can log in on the portal on our website to see them if you need it, or get a copy of your prescription. And please give me a call if anything with your vision changes over the next year. Inflammation, pain, blurriness, anything. Don't hesitate to call. Okay? Well, thanks so much for coming in. It was a pleasure being your eye doctor today. And take care.